started. So, y'all ready? Good? Good. All right, so talking about inflammation, like we mentioned, Dr. Josh Gowdy, I think I mentioned that already too. We said we'll let her go by.
Sorry.
No, you're fine. How are you? All right, so inflammation, right? I'm sure everyone's kind of heard about it. This is not the first time you heard the word, but you might not know what it means, right? One of the biggest bugs inflammation, anytime something to do with drugs, anytime something to do with diet, anytime something to do with lifestyle. What does all this stuff mean? Is there anything to it? Is there anything that's this idea of getting rid of inflammation, where I know it's kind of hard because you got to be wary. Someone's trying to study something, is it legit, or is there just basically snake oil? So we're going to talk about it. Basically, we're going to go through what is inflammation, the history of it, inflammation itself. It's been a known phenomenon for thousands of years. Even going back to like ancient Rome, Celsus identified 4 signs of inflammation, which are rubor, color, tumor, and dolor. Thankfully, Latin is a dead language, so I'm not butchering anything there, which is redness, heat, swelling, and pain. Galen or someone added the 5th sign, which is functional loss. I'm not even going to try to say functional loss. So, functional loss. So those are your 5 current signs of inflammation. And if you think about that, everyone kind of knows that's true, right? You fall, you sprain your knee, roll your ankle, and what does it do? It blows up, it gets red, it hurts, it gets hot, and you can't move it as well as you can the other one, again, because it's injured. We skip ahead 2,000 years. In 2002, Dr. Seaman, who's kind of a well-known guy in our profession, he's a chiropractor, was the first to publish a paper that related diet to inflammation. And so we're going to talk about that more as we go along. But really, and there's been breakthroughs in inflammation between those 2 periods, obviously, but it took 2,000 years from us to identifying what inflammation was to actually relating it to possibly something in the diet. So that's a pretty big deal. So first, let's figure out what inflammation actually is so we can know what we're talking about. We really can't speak about it intelligently if we don't know what it really is. So 2 big phases of inflammation. First is identification. What is going on? So what is inflammation but the body's initial and natural response to some kind of insult or injury? Basically, the first thing that happens is you have specialized immune cells in your body that detect and discover, hey, something is going on, something is changing. That loss of homeostasis or balance in the body. So mechanical damage is detected by certain immune cells, so they say, oh wow, that tissue is damaged, that's not right, I need to do something about this. Conversely, other different types of immune cells can detect foreign particles like bacteria, pathogens, things like that. They say, hey, this is a part of the body, this isn't supposed to be here, let's get rid of this, we need to do something. And that's how it normally acts. Now, as we'll talk about later with autoimmune diseases, your body is misidentifying certain tissues in your body that it should say, hey, we're all on the same team, I don't need to do anything, and it says, hey, I need to attack this. But we'll get into that in just a minute. So once that identification happens, it says, hey, there's a problem, then the really inflammatory process begins. So vascular changes once that issue is discovered. What does that mean? Well, a couple of things. One, vasodilation occurs. Dilation gets bigger, so your blood vessels actually enlarge, which allows more blood flow to the area. So going back to our example of a rolled ankle, you roll your ankle, pain, damaged tissue. Your body identifies, oh, there's some damaged tissue, we need to do something, more blood flow to the area. That's why you'll get immediate swelling when you roll your ankle. You also get what's called an increase in vascular permeability. What does that mean? What that means is the blood vessels, allow more stuff to exit them than normal. So your chemical mediators, your inflammatory mediators, usually stay inside the blood vessel, but when this happens, it changes chemically and it allows the blood vessel to push some of those things out toward the tissue that's either injured or infected or where you're having a problem. So that changes, and then the third step is, and these are all really happening kind of at the same time, but the third thing that happens is you get an increase of stickiness to the molecules. Like, what does that mean? We'll kind of skip to the fourth step, which is going to kind of explain that, which is where your immune cells, which are mostly your white blood cells or different types of those, start to eat the tissue that's either damaged or infected, kind of engulfs it. It's called phagocytosis, where basically you'll see, and you can see it, if you go online, you'll see a white blood cell to find like a bacteria, and it'll basically engulf it, and then it carries it away. And so what it does, this third step where that stickiness increases, what that allows for is it kind of helps that process along. It makes it easier to identify that stuff and stick to it so it can engulf and eat and eliminate either the damaged or the infected tissue. And this is just a picture of some of the different types of immune cells. We're not going to go through all of those. A lot of them are white blood cells, and like I said, they're all involved in different facets, different aspects of immunity. Anyone has any questions so far? No? Okay, good. So, inflammation. Everyone talks in the media like this is a bad thing, right? Anti-inflammatory. If we want to be anti-inflammatory, then inflammation must be a bad thing. Well, that's kind of true. Inflammation is really important. We want to have some inflammation or the ability to have inflammation in the body. It's really the first step in your body's defense system. Like we said, the first part of inflammation is the identification process. So if there was no inflammation at all, you really would have problems with infection, you wouldn't identify them, and you wouldn't be able to get rid of them as quickly. And same thing with injuries, you would have increased healing time because that first phase, that identification and those initial chemical mediators that are there to kind of carry away that damaged or infected tissue, if those don't get there, again, you're going to have problems with healing, with recovery, things like that. So inflammation in the acute phase in the short term typically is a good thing. But where we end up having problems is kind of like a guest that you're having in your home. They're good, right? They're there 2 or 3 days, and then it's like fish. After that so long, they start to smell and you want them out. Same thing with inflammation. Once it overstays its welcome, it does become a problem. So if the inflammatory process is triggered in error, like in an autoimmune disease, it shouldn't be there to begin with, it can be a problem. If it stays when it shouldn't, when it should go, okay, now my ankle's better, but now it's still puffed up, or now I'm not infected anymore, that infection's cleared and I'm still inflamed, that's when we have problems. And that's where we enter that, we leave that acute initial phase and then go to a chronic inflammatory state. And if, again, it's not supposed to be there, or there's some low-level insult, low-level infection, for example, that's keeping it there, but it's keeping us in an over-inflamed state, that's where we get to problems. Does all that make sense? Mm-hmm. Okay.
So in the white blood cells, usually if there's a high count, then there's typically an infection going on. What if there's a low white blood cell count?
It could be any number of different things. It could be that you have too many of the other types of blood cells. So you could have your body's overproducing red blood cells and underproducing white blood cells. You could have an immune problem that's causing your body to underproduce white blood cells. It could be any different number of things that causes a low white count, but a high white count typically is indicative of infection or cancer, actually. So there's a couple different things that can cause a high white count. There are some other things that can cause a low white count. It really just depends. Any kind of immune suppression would also cause like a low
one. So could that be hereditary at all, a low?
It could be, but again, you want to make sure, and it's still usually not a good thing. Again, it depends on the cause. So you need to find out what's causing that. Is it just something you tend to run a little low? And also we're talking, are you running a little low, or are you kind of bottoming out? Right. Also, if you look back at the different types of white blood cells, being low on a certain type or high on a certain type can tell you it gives you an idea if something's more like a viral infection or a bacterial infection or even an allergy. Those ranges change depending on what your body is dealing with. Okay. So again, it depends on the cause. Also, when certain ones are high, others tend to be low. So if that's what the cause is, you might have actually like a certain type of infection that's causing a certain part of your white count to go high, and then your body's just not making as many of the others. And so that's the reason you want to address that infection versus worrying about the low count, because once you get rid of that, everything should balance out.
Okay.
So it really is a maybe. It depends on the cause. Does that make sense?
Yeah, I know I generally seem to, with many physicals I've had, it always tends to be low. Not crazy low, but it's always been.
On the low side.
Mhm.
Again, it's hard to say. I mean, immune support in your case might not be a bad idea, but you know, if you're not prone to getting sick necessarily, and it's not affecting you, excuse me, in an overtly negative way, again, it could just be
Allergies, I know I have a big issue with some.
okay, and that could be part of it. You
Right.
could have a constant kind of like a chronic
Yeah.
insult or something again that's kind of running your immune system ragged. It'd be hard to it's hard to tell you like without looking at
Sure.
the full
Okay.
history of everything.
Sorry to take you off.
No, that's a great question. Okay, so what does inflammation lead to once you get to that chronic phase? Once you get to that bad inflammation? Well, it can lead to organ damage. Chronic inflammation can cause damage to blood vessels, which can cause the excessive plaque to form. We all know about plaquing in the arteries. There's 1,000 drugs out there now to help prevent those things from happening, but inflammation is an important part of that process, and it can drive that plaque to build in those arteries, which again obviously makes you more susceptible to heart attack, which obviously causes damage to the heart. So a lot of heart attacks, a lot of those issues start with an over-inflamed state. You're a state of chronic inflammation in the body. What they're finding now is that inflammation in the brain is linked to Alzheimer's disease, which they didn't think was possible because of the blood-brain barrier, and they're not exactly sure how that works yet, but they are finding that being in an increased inflammatory state, you have a higher incidence of some of these neurodegenerative disorders like Alzheimer's.
Well, how would you know your brain was in?
You don't necessarily know your brain's inflamed.
Yeah.
Some of these other markers for inflammation are high,
Okay.
and they're finding that when these markers are high, these people are also getting things like
I
Alzheimer's,
gotcha.
which they don't think that should again connect, because the blood-brain barrier in theory should prevent that from crossing over. But what they're finding is for whatever reason that's not the case, or there is some other link there that's causing the two to link that we haven't figured out. But it does seem that the inflammation and these the degeneration of that brain tissue seems to be related. Again, the research is still kind of that's not settled science at all. So, lastly, inflammation in the liver can lead to fatty change and cirrhosis, which more commonly when we think cirrhosis, we think either it's some kind of infection like hepatitis, or we're thinking alcohol abuse, but also can happen when you have a chronic inflammatory state. And that's not the most common way. I just wanted to outline that there's a lot of different tissues that can be affected when you're in a state of chronic inflammation. Inflammation, again, what else can it cause? Autoimmune disease. We've already kind of talked about that, touched on that a little bit, but the link between autoimmune diseases and some kind of inflammatory problem, that's pretty obvious because it's a direct causal link. So basically, the body, again, is misidentifying normal healthy tissue as an invader, as something that needs to be attacked. And so the body, autoimmune, self-immunity, is attacking itself. So some examples of that would be rheumatoid arthritis, psoriatic arthritis. I know we all think of psoriasis as the stuff on the skin, but in a lot of individuals, it actually causes joint damage, and that's when we get to the psoriatic arthritis. Lupus, or SLE, which we know is a big problem for people that have it. Ankylosing spondylitis, which is a disease of the spine where the spine starts to basically freeze up and starts to fuse. Gout, everyone know about gout. Anyone ever had someone that had that horrible toe pain?
My
It's
dad
those
had it.
uric acid crystals that are forming, build crystals into the joints and cause severe pain. These are all considered inflammatory arthritides or arthritides. Basically, it's pretty obvious that they're inflammatory since they're all called inflammatory. There is an autoimmune disease that attacks pretty much every tissue or organ system in the entire body. Some only attack one, and some, like lupus, attack multiple different systems, but there basically is not a tissue in the body that is immune to autoimmune diseases, which is interesting. We kind of already talked about how it happens, and basically we've already said how the immune system basically attacks, like it would a foreign invader, but it's attacking regular normal tissue. So that all makes sense? inflammation and metabolism. This is kind of a new emerging science that we're just now kind of really paying attention to this, and that's how does inflammation affect metabolism? The theory, one of the theories is that inflammation causes vascular irregularities. We talked about how during an inflammatory process, your blood vessels act differently. They're thinking that chronic inflammation can cause problems in how your body responds to some of those changes in the vessels, which eventually lead to metabolic dysfunction because those chemical mediators are out there so much, your body stops responding to them normally and properly, which again is kind of the window, it's kind of the first step possibly in leading to a metabolic dysfunction. So metabolic syndrome is characterized by abdominal obesity or a lot of weight gain around the stomach, high blood pressure, increased blood sugar, increase in triglycerides, and low HDL levels, or your high density lipoproteins, which are your good, remember when there's your good cholesterol, that's your HDL there. And so those are the 5 things that are basically, when you have metabolic syndrome, you basically have that pre-diabetes. You can have metabolic syndrome and have diabetes, but you really, once you become diabetic, you kind of know about all these things. These are things you look for as you start to near that, that type 2 diabetic state. A lot of research suggests that inflammation has a major role in diabetes and obesity, again, kind of for the reasons we already mentioned. As it starts to change that metabolism, start to go into that metabolic syndrome, you're really one step away from that diabetes and, again, obesity. We know that type 2 diabetes is a developed diabetes, unlike type 1, which is an autoimmune disease where the body attacks the pancreas. Type 2 is due to insulin resistance. Basically, you're eating a lot of sugar, your body's dumping insulin to, cause that sugar to uptake into the cell. It happens over and over and over again because you're eating too much sugar or for whatever reason, and then your body says, I'm not going to listen to that anymore. It stops listening to that insulin. That's where you start to get a problem there. But again, all that is definitely linked to this metabolic syndrome. Uncontrolled metabolic syndrome will eventually become type 2 diabetes. Any questions on that? All right, so again, where all these things are kind of connected, so we're linking them together. Inflammation and obesity. So how is then the inflammation causing the obesity, which is then linking to these metabolic issues? Well, it's our diet, frankly. It is calorie dense and nutrient poor. So what does that mean? It means that we're getting a lot of calories in something so like a donut. It's very calorie dense. One Krispy Kreme donut is like 300 calories, right? And it's barely anything. You eat it and then it's so good, it melts in your mouth and it's gone, right? Calorie dense. Nutrient poor means there's not a lot of good stuff in it. Your vitamins, your minerals, your good macros, protein, carbs, fat. It doesn't have any of that good stuff in it. So a donut would be something that is calorie dense but nutrient poor. Something that would be nutrient rich but calorie poor would be something like kale, like your cruciferous vegetables, things like that, that have a lot of vitamins, a lot of minerals, but then you eat a whole bowl of broccoli and it's like 50 calories, right? So that doesn't necessarily mean that that's a bad thing. It just is good to, in general, if you're just eating a bunch of empty calories, you're probably going to have problems. That's not to say that some calories are both. They're both calorie dense and nutrient dense, and that's not necessarily a bad thing. You just want to make sure that you're not eating a bunch of empty calories. Research has shown that nearly 40% of calories in American diet are from sugar or refined flour. That is way more than they should be. Because diets that are high in processed carbs and processed fats cause the release of inflammatory mediators. So you get inflammation. I eat something now, I'm going to get that change now, but you get long-term changes too. As you continue to do that, obviously you're going to gain body fat, but as your body fat grows and increases, it actually changes. In lean individuals, these two chemical mediators, interleukin 10, and I've been practicing this one all day, adiponectin, are secreted by the body's fat cells. Both are anti-inflammatory. As you get obese, as you become overweight, those fat cells in your body actually start secreting different chemicals. They will then start to secrete your C-reactive protein, tumor necrosis factor, and interleukin 6, which are all pro-inflammatory. Those are all part of the inflammatory process. Those are things that you should have when you have some kind of injury or pathogen, but things that you're getting they're just secreting them all the time once they start to gain size. Also, one thing that changes, as those adipose cells grow, as those fat cells in your body grow, the immune cells will actually enter them and activate, which makes them kick out even more inflammatory mediators. So this becomes like
Cyclical.
exactly, it becomes like a positive feedback loop where instead of a negative feedback loop where you turn something on, you get to a certain point, oh, it's too much and it turns it off. You get to that point where you turn something on and then it just doubles down and then it just keeps going and going and going to where once people start gaining weight and having these problems, they only get worse. I mean, very rarely do you see someone say, oh yeah, I'm 50 pounds overweight and I was 50 pounds overweight 10 years ago and I had blood sugar issues that were controlled with X, and that has not changed. It's always, have you ever heard someone that wasn't taking good care of themselves but they had to go on less insulin or less of their hypertension medication or less? No, that doesn't happen. They have to make a change for that to happen. Again, because once these changes start to occur, it becomes a positive feedback loop. Does all that make
Is
sense?
refined flour the same as enriched flour? What
Enriched,
exactly is that?
yes, they're the same thing largely.
Okay.
Refined flour just means that it's been commercially broken down from whatever grain it was into the flour. So it's gone through that process. Enriched means on refined products like that, what they've done is they've taken out so many of the vitamins and minerals, they actually have to add them back in at the end. So enriched flour is just a type of refined flour. And it's basically telling you, yeah, we've sucked out all the good stuff,
Right.
because now we have to add it back in. So they'll add back in like B vitamins. A lot of times they'll put that in flour, but adding vitamin D to milk, things like that, where something wasn't there or was taken out, and we're adding it back in because we've really just taken all the good stuff out.
Right.
Does that make sense?
Yeah.
That's a great question, though. So how do all these things really go together? Well, like we said, the fat cells, once you become obese, they lead to those inflammatory markers being secreted all the time. An estimated 25 to 40% of the American population may have pro-inflammatory metabolic syndrome. So they're at that point where their diet's not good, and all these things have become a problem to the point where you're in that spot where you're starting to just really secrete more and more inflammatory markers, and things are just going to get worse and worse and worse. Once that happens, you're going to be in more pain, and that's what the research has shown. Neck and shoulder pain are more prevalent with people with metabolic syndrome. Same thing with low back and disc herniation, more prevalent in people with metabolic syndrome. Metabolic syndrome, and this is a big one, promotes osteoarthritis. So DJD, degenerative joint disease, where you just got normal wear and tear of your joint. My knee looks a little worn down. The thinking there was, oh, well, that's just normal age related, it wears down. You might have had an injury, made it wear down a little faster, something along those lines. What they're finding though, is the same inflammation that causes the plaquing in your arteries is causing that, that degeneration in the joints to happen at an accelerated rate. And that's kind of scary, that, you know, basically even your musculoskeletal system can break down due to this chronic inflammation. Lots of other things though, and some things that people kind of already knew: headache, fibromyalgia, abdominal pain, and chronic widespread pain are all more prevalent in the overweight and obese populations. So, like I said, scary stuff once you start to look at all that. So now what? This has all been pretty negative so far, right? Doom and gloom, oh no, we're all gonna die of inflammation, right? Well, not necessarily. Is there something we can do about that? And I know some of the stuff's probably gonna make sense. So, medical model, you know, unfortunately, I think they're going to catch up, but right now some of the interventions are not necessarily super helpful, and they're not getting rid of the problem. The use of prescription painkillers and the overuse and now the abuse has led to what's called the opioid crisis. This is a big problem in our healthcare, where basically we've got a whole bunch of people that are addicted to legal narcotic painkillers, but now they're trying to get them illegally. It's causing a lot of, you know, illegal stuff to go around with these drug pill mills and things like that. It's bad stuff, and so we got to do something about that. But even your over-the-counters, NSAIDs or non-steroidal anti-inflammatory drugs, they increase the chances of stroke, heart attack, stomach ulcer, leg swelling, hypertension, dizziness. I put the little ... there because there's more. So overuse of those drugs can also cause problems. And now I'm not saying, you get a headache, once a month and you take an Advil, that's a bad thing. But a lot of people, I have a lot of patients that are taking 4, 5, 6 Advil every day just to get through the day. And I'm like, well, okay. That's where we start to end up with problems. That's where we start to get kind of scary. Acetaminophen, does anyone know that's the active ingredient in Tylenol? It is the leading cause of acute liver failure in the United States of America.
So is that also in it, let's say Excedrin, ibuprofen,
Which one?
acetaminophen?
No, acetaminophen is in Tylenol, and it's also in a lot of your opioid drugs. For some reason, I don't know. You'd have to ask the manufacturers. So
Advil,
ibuprofen,
Tylenol.
that's the actual Advil's ibuprofen, and then I think Aleve, I think, is naproxen, and those are your NSAIDs. But the acetaminophen's a painkiller. It's analgesic, but it's not a non-steroidal anti-inflammatory drug.
Acetaminophen is an Excedrin.
Oh, it's Excedrin. That's right.
Acetaminophen, aspirin, and caffeine.
Yes.
Okay, oh, caffeine, coffee.
Thank you for the help in the side right there. So from 2001 to 2010, 1,500 people died from an accidental acetaminophen overdose. So I mean, it is a real problem. Again, especially these are accidental. These are not like intentional. I overdosed and took a whole bottle full of Tylenol. These are accidental overdoses, and that's again kind of staggering numbers if you think about it. Since it's an over-the-counter drug. But all drugs have side effects. All your medications for hypertension, blood sugar, etc., all have problems. All have side effects ranging from mild to pretty serious. Diet, exercise, and healthy living. I don't want to say that they aren't. Every doctor you've ever been to that has said you need to do these things. Unfortunately, it seems like they're not necessarily put on the front. They're not put on the forefront. They're not necessarily an official part of the management plan. I mean, most people, and some people do. I don't want to talk about MDs badly, but very few of my patients that I've seen have gone to an MD and he handed them an exercise program. This is what you need to do, and I'm going to keep up, and I'm going to ask you whether you've been doing these things, and we're going to keep track of what you have problems with, what you can and can't do. Here's your diet plan. I want you to meal plan. I want you to buy all this stuff. I want you to learn how to cook all these things. If you don't know how to do it, we're going to talk about it. That's really not the level of management, but they're doing that with your prescription drug. Are you taking your prescription drug? How are you having the effects? Okay, we're going to lower your dose. We're going to increase your dose. We're really not doing that, at least on the medical side, mainstream-wise, with diet and exercise and just healthy lifestyle changes. So chiropractic options. Well, as chiropractors, obviously the big thing we do are chiropractic adjustments. And chiropractic adjustments have been shown to lower those levels of the inflammatory markers in the blood, at least in the short term. Now, and so that's possibly why when you get adjusted, you feel better. Now, this is not a long-term solution, so I don't want you to make it sound like I'm saying, hey, come get adjusted every day and your inflammatory markers systemically will lower. That is not what I'm saying. But chiropractic does have at least a short-term benefit of lowering some of those inflammatory markers. We do not prescribe medication. What that means is we cannot rely on those things to get rid of your symptoms. I can't prescribe you, codeine for your pain. So I have to find another way to get you out of pain. As a chiropractor, what we try to do is we try to find the source of the problem and say, what do we need to do to fix that? Lifestyle modification, once you get to the point of chronic inflammation, is almost always necessary. So I don't want to make it sound like there's some magic bullet, some magic thing that I as a chiropractor am going to have you do that, bam, my inflammation is gone. Once you get to that chronic inflammatory state where you're kind of in that positive feedback loop, you're going to have to make some changes. You're going to have to make some big changes, and you're probably going to have to make them yesterday. So that is kind of the hard part about it. Exercise, nutritional supplements, and dietary changes are all things that can be helpful. It depends on the case, but all things that are definitely big and all things that we do. So we're going to talk about a few of them. Diet. So anti-inflammatory diets, I'm sure you've heard, very popular. I'm sure you've heard of one or more of them. Sure, maybe you've been on one or more of them. Paleo, Mediterranean diet, keto diet, all plans that, not necessarily by design, but as a kind of a side effect, all help limit inflammation. Another thing that's shown a lot of promise as far as limiting inflammation dietarily is intermittent fasting. Stopping, not eating for a period. There's a lot of different protocols out there. Dr. Dave and I are on the 16 and 8, where you go fasting for 16 hours and then you eat all your food for the day during an 8-hour period. There's a 2-day-a-week, 24-hour fast for every 5 days you eat normally, and then 2 days a week you don't eat like the entire day. That doesn't sound fun to me, so I haven't tried that one. But that showed a lot of research is promising as far as fat loss and also lowering your inflammatory levels. But the important thing to remember is that not all people respond to foods the same. So if you have celiac, you're going to be gluten intolerant. I can eat, flour, enriched flour, fine. Now, it's still pro-inflammatory, but I'm not going to have a violent reaction. Someone that is, say, lactose intolerant. I drink milk fry. Again, dairy is pro-inflammatory, but I don't have the violent reaction. So you have to remember that some foods you're going to find are things you need to stay away from, and some things you can probably have in moderation, and it's not a big deal. Food diaries are extremely helpful if you're finding that you're having digestive issues or inflammatory issues and you think it's related to your food but you're not sure how. A food diary is the cheapest, easiest way to do that. You just write it down, or I'm sure there's apps for your phone. You just write down what you've been eating, and then you find, oh, I felt really bad like the next day. Every time I drank milk, then I probably shouldn't drink milk. And if you eliminate milk from your diet and you stop feeling that way, there you go. Pretty simple. Elimination diets, again, are another thing that you can use if you're having problems finding. They're a little more drastic, where you really pare down what you eat to a very select number of foods, wait for things to get better. Once things get better, then you start to slowly add things back. Again, that's very restricted. That can be very difficult, but it can be necessary if you're not able to find out what food sensitivity might be the cause of your problems.
So it's like Whole30.
I'm sorry. Yeah, that's exactly. That's one example. There's quite a few different protocols out there for how to do elimination diets. Again, knowing if you have any food sensitivities beforehand can help kind of draw you toward one that kind of works best for you. But yeah, there's quite a few different elimination diets. I have quite a few people that are colleagues that are functional medicine doctors. They put people on a water fast for like a day or two, and you just like drink water for a couple days and just let all that inflammation kind of clear out of the body, kind of start from almost like a ground zero. Again, that sounds awful to me, but in cases where someone's really inflamed and diet's part of it, you really got to take really strong measures to improve that. That's a great question. So these are kind of my general dietary guidelines. This is a joke, I'm not saying you should go on the taco cleanse. I love tacos, so this would be my jam right here, but it's not probably a good idea. So focus on the whole minimally processed foods. Stay on the outside of the grocery store, your lean meats, your fresh fruits and vegetables, those types of things. You have to watch your label. Look at the label. Look for your added sugars. A lot of people sneak added sugars in things that are somewhat seemingly innocuous, like your condiments, your sauces, things like that. Things you think are probably okay might have a lot more sugar than you think. Again, processed grains and dairy, pro-inflammatory. As a general rule, I kind of stay away from them. I still eat things like cheese. My wife, after years of nagging me, has gotten me off of cow's milk because it's pro-inflammatory. There's a lot of options out there, coconut milk, almond milk, cashew milk. They've got you can milk everything now. And then you want to limit the excessive amounts of saturated fat, which is, again, been shown to be pro-inflammatory. Again, different people will argue a little bit about that one, but you definitely don't want to go excessive in your saturated fat. Watch your oils. Not all oils are the same. Things that are good oils, like your olive oil and your coconut oil, they don't have a super high smoke point, so you don't necessarily want to cook with them. Avocado oil has a much higher smoke point. It is much more stable when you cook with it. It doesn't denature or change, and so those are better to cook with. You also want to limit your omega-6 oils, which are like your grapeseed oils, peanut oils, things like that, because omega-6 are pro-inflammatory. Now, I know you might be thinking, okay, omega-6 are essential fatty acids. We have to get omega-6. Almost no one doesn't get enough omega-6. Your omega-3s, which are your other essential fatty acid, you tend to get much less of than omega-6, and when that ratio of omega-6 to omega-3 gets out of balance, that's when you get into a pro-inflammatory state. So almost no one doesn't have enough omega-6 in their diet, just regular American diet. So you want to focus on kind of limiting those where you can.
Isn't the extra virgin olive oil better than the olive oil from a smoking point on the heat scale?
Once
From
you
the-
heat it, it doesn't matter. That's what the extra
part of
virgin
it.
means,
Okay.
is that it's processed. It's not heated really when it's processed. So once you heat it up in a pan, you might as well be using regular olive oil. And again, it's not one of the better oils to use because the smoke point is not as high as other oils like avocado oil, which they have at Costco.
But in salad dressings and so forth, isn't that better? Because I know
Yes,
Mediterranean is all
absolutely.
about the AVOO.
Yes.
Yeah.
And so yes, if you're eating it cold, you want to use the
Right.
extra virgin olive oil because it has not been heated. So for olive oil, you really don't want to, in general, again, this is not like you have to do it every time, but in general, you don't want to eat olive oil once it's been heated, either in the processing of it to make it or when you're cooking with it.
Does the coconut oil inflame at all? I know from what I've read with people with heart issues or taking heart meds, that, because my dad had that, and I looked on the list of foods that they told him to stay away from, and why is coconut oil always
Because
on
it's
there for
saturated
heart?
fat.
Okay.
Because it is high in saturated fat. Again, you know, I don't have a strong stance because again, they're still kind of arguing about that.
Right. Okay.
So some people love the coconut oil because the saturated fat does mean it's better for satiety. It fills you up more, so you're going to eat less from a caloric standpoint typically.
Okay.
Cold, it does do better than cooking with it, again, because it does the nature of once you get it hot. It does have medium chain triglycerides, which are good for you and good for energy. But again, it has a lot of saturated fat in it. So
Okay.
if you have a heart condition, would I say coconut oil is your go-to? Yeah, probably not.
Okay.
At least for right now, until we get kind of
More info.
figured out more info, until the research is more settled.
Sure.
I'm not a researcher, so I'm just kind of telling you what I've read. You know, my opinion on that, one way or another, honestly, doesn't matter because we're still not sure.
Yeah.
Does that make sense?
Well, the olive oil. Back to that.
Yes, ma'am.
So when I don't ever fry and coat anything
Mhm.
like my mother did.
Right.
But if I want to do like some chicken tenders and I shouldn't do it in olive oil.
It's not that you should. There are better oils out there. Like I
Okay.
said, avocado oil has the highest smoke point of I think any oil. That's a great
Okay.
to use.
Mhm.
Like I said, they have it at Costco.
Yeah.
It's
What
more
about
expensive.
Safflower oil for salad dressings because you're not heating it, but I know I've kind of.
I can't
heard
remember.
of
That one might be
something.
high in omega-6. I'd have to look that
I think
one
it
up.
is.
Yeah.
I think it is. Yeah.
So like I said, I mean, olive oil is great for salad dressing.
Gotcha.
Again, extra virgin because you're not heating it.
Extrovert. Yeah, I'll have
Yeah.
to get the avocado.
Did we say no on avocado dressing and oils?
You'll look good on avocado. Avocado is good for everything.
Okay, that's,
Good question.
I missed that.
And then lastly, again, be aware of the foods that negatively affect you. Avocados, great food, right?
Mhm.
If you swallow like a blueberry every time you eat avocado, don't make avocados a big part of your diet. Be aware of the things, even with a diet, that affect you poorly. Even if it's like, I feel bloated afterwards, I feel tired afterwards, I kind of get itchy or I feel bad the next day. Be aware of those things and eliminate those things from your diet too. So something that might be worse for you in general, but you respond better with, might be a better idea for you. So just keep that in mind, that these diets, we get really hooked on them, but be aware of what your body's telling you at the same time. Supplementation, big thing here, as far as taking in things that you might not be getting through your diet. Low vitamin D levels have been associated with low back pain, metabolic syndrome, and chronic inflammation. So we need to make sure that we're getting outside, getting our vitamin D that way. That's the best way to get your vitamin D. If you have to take a supplement, a D3 supplement is better than a D2 supplement. Turmeric, curcuminoids. We heard about turmeric. Turmeric is like the big thing out right now, right? And anti-inflammatory. It's better than Advil. It's the newest miracle, right? But the research so far has actually been very positive. You are getting the same or better results as far as pain relief compared to your NSAIDs without the negative side effects like the bleeding, without, again, some of that negative stuff that you see.
The D3, how much do you recommend taking?
It depends. It really depends on how low your blood levels are.
Okay.
If you're trying to maintain versus, because if you're maintained and you're at like a high level in the blood, you might not need any supplementation to begin with. If you're really, really low, and again, also it depends on if you're having some of those symptoms, if you're having that fatigue, those muscle aches and things like that, even brain fog, if you're having that and you're real low, I would probably prescribe a higher level than if, you're at, just barely, and you're not, barely low and you're not really having a lot of symptoms. If you're gonna go on those higher doses though, then you wanna retest your blood levels. Again, depends on how high, but every month or two so you can see like what effect that's having on you. Is that absorbing? Is that actually changing your blood level?
Okay.
Does that make sense?
Yeah.
Where are we at? Omega-3 levels in the blood are associated with lower mortality and cardiovascular events. Now these are blood levels because there's been some new research that's come out that says that omega-3 supplementation might not be the best, but omega-3 levels in the body are definitely associated with lower mortality and cardiovascular events. So we might end up finding that eating your wild caught fish that are high in the omega-3s is actually far superior to taking a supplement. Again, that's just really, really new research come out like a couple months ago. So we'll see about the omega-3 supplementation. And that's what I mentioned there. Exercise. It's a big one. It's been shown to decrease fat mass and increase lean body mass, right? Build your muscles, decrease fat, everyone kind of knows that. Mounting evidence shows, though, it does help combat chronic inflammation. So it lowers those inflammatory levels, kind of helps fix that problem that we were talking about before. Resistance exercise increases lean body mass, which by increasing your muscle mass, it increases your metabolic rate, can help fix some of these problems that we're talking about. A lot of people, when they do weight loss and they think exercise, they start thinking cardio. Cardio is important, and I don't want to take away from that. But a lot of people say, oh, I don't want to get bulky. Resistance exercise is an important part of that equation. It really is. To build the muscle, to support your body, but also to increase the metabolism. Exercise also has many analgesic or pain relief benefits. Ever heard of the runner's high? Those endorphins that are let out by the body, secreted by the body after a hard workout. Those, again, when you're having this chronic pain, can be really a lifesaver and kind of tell your body, hey, this is a good thing, and maybe help you kind of push into that. So, what does all this mean? Well, chronic inflammation is a big problem here in the U.S. It's involved in everything from diabetes to heart disease, chronic pain, and especially autoimmune issues. A lot of it has to do with our diet. Our diet is bad. We mentioned all the reasons why, and everyone kind of knows. You go out, you go up to eat, and you're getting fried chicken, or you're eating pizza, or my tacos. Not necessarily a good thing to eat all the time. Or even those nachos. Love nachos. Diet, rising obesity, and sedentary lifestyles really come together to cause a lot of these issues. As chiropractors, how do we help? Well, we're going to look at your health as a whole. We're going to say, hey, are there some dietary things that might be causing you some chronic pain issues that we aren't able to clear? We do talk about nutrition. We do talk about exercise. It's a big thing for most chiropractic offices, and definitely something we like to focus on. Not necessarily from direct management standpoint, but things we're asking about, things that we're making sure that you're doing on your own. Because even if you're doing them here, you exercise here, you're not coming here enough to really make that a habit. So, and you're not eating here, hopefully. I haven't adjusted anyone while they were eating a salad. So, these are things that you kind of have to do at home, but they're very important aspects. And again, we're here to not just, you're here for neck pain, you're here for headaches. That's great. You come in, we do want to fix those things. But the other thing is, we want you to be healthier overall. I don't want you to fix your headache and then you die of a heart attack, 3 months later. We haven't really helped you out that much in that case. So it's not about just getting rid of your pain, getting rid of what you're here for, but it's also about helping you live a healthier, happier, more functional life, doing things you want to do. My last 2 slides are just references. Anyone wants the references, I'll email them to you. It's not a problem at all. Any questions? No? Okay. Thank you very much for coming.
Thank you.
Thank you.
That was
Awesome.
good.
Awesome. Thank you so much. Thank you.
All right.
Awesome.